Namaste. Today, I will be discussing about dental anesthetics. So what are the types of dental anesthetics? So anesthesia means a lack or loss of sensation. These can be with or without consciousness. Today, there are many options available for dental anesthetics. Medications can be used alone or combined for better effect. It's individualized for a safe and successful procedure. So, the type of anesthesia used also depends on the age of the person, health condition, length of the procedure, and any negative reactions to anesthetics in the past. So, anesthetics work in different ways depending on what's used. Anesthetics can be short, acting when applied directly to an area, or work for longer times when more involved surgery is required. So, the success of dental anesthesia depends on the drug, the area being anesthetized, the procedure, individual factors. So other things that may affect dental anesthesia include the timing of the procedure. So research also shows that inflammation can have a negative impact on the success of anesthetics. Also, for local anesthesia, teeth in the lower jaw, the mandibular section of the mouth, are harder to anesthetize than the upper jaw, the maxillary teeth. So there are three main types of anesthesia: the local, the sedation, and general. Each has specific uses, so these can also be combined with other medication. So local anesthesia. So local anesthesia is used for simpler procedures like a cavity filling, which requires a shorter time to complete and is generally less complicated. You will be conscious and able to communicate when you get a local anesthetic. The area will be numbed, so you won't feel pain. So most local anesthetics take effect quickly within 10 minutes and last 30 to 60 minutes. Sometimes a vasopressor such as epinephrine is added to the anesthetic to increase its effect and to keep the anesthetic effect from spreading to other areas of the body. So, local anesthetics are available over the counter and as a prescription in gel, ointment, cream, spray, patch, liquid, and injectable forms. They can be used topically, applied directly to the affected area to numb, or injected into the area to be treated. Sometimes, light sedation is added to local anesthetics to help relax a person. So, examples of local anesthetic, they are the articaine, bupivacaine, lidocaine, bupivacaine, and prilocaine. So, the sedation. Sedation has several levels and is used to relax a person who may have anxiety, help with pain, or keep them still for the procedure. So it can also cause procedure amnesia. So you might be fully conscious and able to respond to commands, semi-conscious or barely conscious. Sedation is categorized as mild, moderate, or deep. Deep sedation can also be called monitored anesthesia care or MAC. In deep sedation, you're generally not aware of your surroundings and can only respond to repeated or painful stimulation. So, the medication might be given orally, the tablet or liquid, inhaled, intramuscularly or the IM, and or intravenously. So, there are more risks for sedation. Your heart rate, blood pressure, and the breathing must be carefully monitored in moderate or deep sedation. Medications used for sedation: the diazepam or the Valium, midazolam or the Versed, propofol or the diprivan, and lastly the nitrous oxide. Next, the general anesthesia. So general anesthesia is used for longer procedures or if you have a lot of anxiety that might interfere with your treatment. So you'll be completely unconscious and have no pain. Your muscles will be relaxed and you'll have amnesia from the procedure. So the medication is given through a face mask or 4. the level of anesthesia depends on the procedure and the individual patient. There are 4 risks with general anesthesia. So, general anesthesia medications. So, they are the propofol, ketamine, etomidate, midazolam, diazepam, methotrexate, nitrous oxide, disflurane, isoflurane, sevoflurane. So, other than the risk with general anesthesia, so there are the side effects of dental anesthesia. So, side effects of dental anesthesia depend on the type of anesthetic used. General anesthesia has more risk involved with its use than local anesthesia or sedation. So, reactions also vary based on individual factors. Some reported side effects with sedation and general anesthesia medication include like nausea or vomiting, headache, sweating or shivering, hallucinations, delirium or confusion, slurred speech, dry mouth or sore throat, pain at the site of injection, dizziness, tiredness, numbness, and lockjaw or the trismus that caused by trauma from surgery. The jaw opening is temporarily reduced. So, vasoconstrictors such as epinephrine added to anesthetics and it can also cause heart and blood pressure problems. So, these are some reported side effects of anesthetics. Ask your dental care team about your specific medication and any concerns that you may have about the medication. So, special precautions when taking dental anesthetics. So, there are conditions and situations in which you and your doctor or dentist will discuss if dental anesthesia is the best choice for you. So, the treatment consent is an important part of the pre-treatment discussion. Ask questions about risk and safety precautions that will be taken to ensure a positive outcome. So, like pregnancy. If you're pregnant, your dentist or surgeon will discuss risk versus benefits of anesthetics for you and your baby. It's special needs. So, children and those with special needs require careful evaluation of the type and level of anesthetics they need. And children may need those adjustments to avoid adverse reactions or overdose. So, the Food and Drug Administration or the FDA issued a warning about numbing agents commonly used for teething pain. So, these products are not safe for use in children under age 2. So, do not use these medications without discussing it with a healthcare professional. So, children and adults with special needs may have other medical complications which increase risk with anesthetics. So, for example, a study found children with cerebral palsy had the highest number of airway-related adverse reaction to general anesthesia. So, in older adults with certain health problems may need those adjustments and careful monitoring during and after surgery to ensure their safety. Some people might experience delirium or confusion and memory problems after surgery. So liver, kidney, lung, or heart problems. So here, people with liver, with these problems, might need those adjustments because the drug might take longer to leave the body and have a more powerful effect. So, certain neurologic conditions. So, if there is a history of stroke, Alzheimer's disease, Parkinson's disease, thyroid disease, or mental illness, there may be an increased risk with general anesthesia. So, other conditions. So, be sure to let your dental team know if you have a hiatal hernia, acid reflux, infections, or open sores in the mouth, allergies, severe nausea, and vomiting with anesthetics, or are taking any medications that can make you drowsy like opioid. People at risk from dental anesthesia, like they are sleep apnea, seizure disorder, obesity, high blood pressure, heart problems, children with attention or behavior disorders, chronic obstructive pulmonary disease, COPD, gastric bypass surgery, substance misuse, or substance use disorder. Other than that, there are the risks of dental anesthesia. So most people don't experience adverse reactions with local anesthesia. There are higher risks with sedation and general anesthesia, especially in older adults and people with other health complications. So there's also an increased risk with a history of bleeding disorders or with medications that increase the risk of bleeding, like aspirin. So if you're taking pain medications such as opioids or gabapentin or anxiety medications like benzodiazepines, let your dentist or surgeon know so they can adjust your anesthetic accordingly. Risk of anesthesia. The risk of anesthesia include an allergic reaction, so be sure to let your dentist know about any allergies you have. This includes to dyes or other substances. Reactions might be mild or severe and include rash, itching, swelling of tongue, lips, mouth or throat, and difficulty breathing. Seizures, stopping breathing, heart failure, heart attack, stroke, low blood pressure, malignant hyperthermia. So it is a dangerous increase in body temperature, muscular rigidity, breathing problems, or increased heart rate. Some people ask that when is general anesthesia used and is it safe? So general anesthesia is very safe. And even if you have significant health problems, you will lose likely tolerate general anesthesia without serious problems. But with any medication or medical procedure, you may experience some side effects. Here's what to expect. So, what are those short-term side effects that are possible? So, most side effects of general anesthesia occur immediately after your operation and don't last long. Once surgery is done and anesthesia medications are stopped, you'll slowly wake up in the operating room or recovery room. You will probably feel groggy and a bit confused. So you may also feel any of these common side effects like nausea and vomiting, dry mouth, sore throat or hoarseness, chills and shivering, confusion and fuzzy thinking, muscle aches, itching, bladder problems, and also dizziness. So aside from that short term, there is a long term. So what are those long term side effects that are possible? So most people won't experience any long term side effects. However, older adults are more likely to experience side effects that last more than a couple of days. So these may include post-operative delirium and post-operative cognitive dysfunction, or the POCD. The post-operative delirium. So some people may become confused and disoriented or having trouble remembering things after surgery. So this disorientation can come and go, but it is usually goes away after about a week. So post-operative cognitive dysfunction, or the POCD. Some people may experience ongoing memory problems or other types of cognitive impairment and after surgery, but it's unlikely that this is the result of the anesthesia. It seems to be a result of the surgery itself. So, some research suggests that people over age 60 may be more likely to develop POCD, or the post-operative cognitive dysfunction. So, you may also be more likely to develop the POCD if you have had a stroke, heart disease, lung disease, Alzheimer's disease, and Parkinson's disease. If you have trouble understanding the local anesthesia, so again, local anesthesia refers to using a drug called an anesthetic to temporarily numb a small area of your body. Your doctor might use a local anesthetic before doing a minor procedure such as skin biopsy. You might also receive local anesthesia before a dental procedure such as tooth extraction. Unlike general anesthesia, local anesthesia doesn't make you fall asleep. So local anesthetics work by preventing the nerves in the affected area from communicating sensations of pain to your brain. So it's sometimes used with a sedative, so this helps you relax. So what are the types of those local anesthesia? So these local anesthesia. So there are two main types of local anesthetics depending on how they administered. So topical anesthetics. So these topical anesthetics are applied directly to your skin or mucous membranes, such as the inside of your mouth, nose, or throat. They can also be applied to the surface of your eye. Topical anesthetics come in the form of liquids, creams, gels, sprays, patches. So in some cases, your doctor might use a combination of local anesthetics for a more long-lasting effect. So examples of procedures that might involve topical anesthesia. So like applying or removing stitches, anything involving a needle poke, for insertion, catheter insertion, laser treatments, cataract surgery, and endoscopy. So the OTC or the over-the-counter topical anesthetics such as benzocaine or the Oragel can also help manage pain from a tooth, gum or mouth sores, open wounds, sore throat, minor burns, poison ivy rash, bug bites, and lastly the hemorrhoids. So, local anesthetics can also be given as an injection. Injectable anesthetics are typically used for numbing during procedures rather than pain management. Procedures that might include an injection of a local anesthetics include dental work such as a root canal, skin biopsy, removal of a growth under your skin, mole or deep wart removal, pacemaker insertion, and lastly the diagnostic tests such as a lumbar puncture or a bone marrow biopsy. So, which type do we need? So, the list above are the general examples. So, several of these procedures, such as cataract surgery, can be done with either type of anesthetic. So, your doctor will determine the best type of you based on several factors, including the length of the procedure, the size and location of the area that needs numbing, any underlying health conditions you have, and any medications you take. So, how is it administered? So you don't need to do much to prepare for local anesthesia. Just make sure to tell your doctor if you have any open wounds near the affected area. Take any medications, especially ones that increase your risk of bleeding, such as aspirin, and you have a bleeding disorder. So you'll be given local anesthesia shortly before your procedure to give it time to start working. This usually only takes a few minutes. While you shouldn't feel any pain, so you might still feel a sensation of pressure. So tell your doctor right away if you start to feel any pain during the procedure. They may need to give you a higher dose. Local anesthesia usually wears off within an hour, but you may feel some lingering numbness for a few hours. As it wears off, you might feel a tingling sensation or notice some twitching. Try to be mindful of the affected area while the anesthesia wears off. It's very easy to accidentally injure the numbed area in a few hours following a procedure. So for OTC or the over-the-counter local anesthetics like Oragel, be aware that it may sting or burn a little when you first apply it. Never use more than the recommended amount on the product's label. So it can be toxic if too much is absorbed in your skin. So what are these side effects? So local anesthetics are generally safe and usually don't cause any side effects, aside from some tingling as it wears off. However, if you're given too much or the injection goes into a vein instead of tissue, you might have more side effects such as ringing in your ears, dizziness, numbing, twitching, and a metallic taste in your mouth. So, in extremely rare cases involving very high doses, anesthesia may cause seizures, low blood pressure, slowed heart rate, and breathing problems. So, it's also possible to have an allergic reaction to an anesthetic, but this is rare. So, a 2011 study estimates that only about 1% of people are allergic to local anesthetics. So, in addition, most allergic reactions to local anesthetics are due to a preservative in the anesthetic rather than the drug itself. So, again, local anesthesia is a relatively safe way to numb a small area before a procedure. It can also help manage pain on your skin or in your mouth. So while it can occasionally cause side effects, So this is usually only happens in cases that involve doses above the recommended amount.
We can be golden, why don't we show them all of the life there's meant to be?